Smoking is something that's often started in people's youth, and the problems, of course, may manifest themselves decades later. We actually know that a good number of our patients that are admitted to hospital that are smoking are over 65, so they're elderly. Many of them we know have been smoking for decades, and many of them are at a socioeconomic disadvantage, having a lower education, lower income.
We are here to meet them where they are, and it is very important that they know that they can come to us, even if they have not cut down or they haven't stopped. Eventually, together we will get them to where they need to go, and that means a lot to us.
Smoking impacts on so many different aspects of disease. Clearly you can associate, a high prevalence of smoking amongst people with lung disease, and certainly I know on our respirology floor that over 30% of our patients that are admitted are smokers. Certainly a high indication with cardiovascular disease, but people kind of associate a lot of the issues with smoking like what they see on the cigarette package and lung disease and heart disease, but in fact smoking can impact on so many different aspects of people's health.
What I'd like to find out first from anybody who comes through is what their smoking is like. Well, how much do they smoke? What did they smoke before? Because oftentimes someone will come and they'll say, I smoke a pack a day. And instead of meeting them with, oh, that's a lot of, you're going to have cancer, you're going to have COPD, you're going to have a heart attack, stroke. We have to find out, maybe they were smoking 2 packs before. Maybe this is an accomplishment. Maybe they've already done some very good work.
One of my catchphrases is that it's never too late to quit, and I'm not just making that up because it is absolutely true. And we know that even within 24 to 48 hours, you start to clear out carbon monoxide out of your system, which can impact on circulation and heart functioning. And within a couple of weeks, you start to breathe better. There's better lung function mechanics. If you had a heart attack and you can quit smoking, you reduce your risk of a second heart attack by 50% once you stop for a year. And if you can maintain yourself as a non-smoker, after 10 or 15 years, your risk for heart attack is the same as a non-smoking population.
I would want to know from this person, have they ever quit before? It's important to understand what has worked for them in the past, what might work for them again, and what successes we can build on. And then what the relapses have been like what did they learn about this habit of their own personal habit. Once I understand where they're coming from, sometimes I like to ask, what do you have in mind? If I was going to give you an advice now, what would you like it to be? And sometimes people come in with a very clear idea of how they want to take the next step of quitting.
We've started to work on developing a comprehensive program, so we've built things in Garron Hospital into our electronic health record. So we can record when patients, are coming in, whether we know whether they're smoking or not, so we can offer nicotine replacement products. So we also have pharmaceutical modules built into our electronic system so that anybody that's smoking can be ordered some medications to help, with the relief, even if while they're in hospital, such as nicotine patches.
I think people like this kind of approach because it gives them agency, it gives them a sense of control, right? Okay, someone's not telling me I have to stop tomorrow. Someone's not telling me put down a date in blood when I'm going to put down my last cigarette. This person is going to work with me on improving my health, and so I will give it a try. And so sometimes they will try it, and then we'll modify plan B, plan C, plan D.
As people get older and their metabolism changes and they develop other, health issues and comorbidities, helping our patients quit smoking is really the single best thing that we can do to improve quality of life and also longevity in our senior population.